Today's topic would be a very important topic from anatomy, ENT and MCH head and neck surgery. I will be taking up very important points about the first cranial nerve, which is the olfactory nerve. To start with, this is a nerve of smell and it is one of the smallest cranial nerves. The course starts from the nasal cavity, olfactory mucosa in the nasal cavity, and from the olfactory mucosa we have got small olfactory nerve fibers going vertically up towards the base of the brain. There is this very important piece of bone, the cribriform plate of ethmoid, which has got small sieve-like pores, and these nerve fibers just travel in relation to these pores and come to a point near the base of the brain, the frontal lobe of the brain, wherein we have got the olfactory bulb. And from the olfactory bulb starts the olfactory stria, the medial and the lateral olfactory stria, going to the olfactory centers, the prepiriform area and the periamygdaloid area, which are a part of the limbic system. So the course anatomically is olfactory mucosa, small olfactory nerve fibers, olfactory bulb, medial and lateral olfactory stria, and olfactory centers. We have to be acquainted with this course. After that, we can be having dysfunction, olfactory dysfunction, and a clinical condition in which we can have a total loss of smell, anosmia. Sometimes we can have a decreased perception of smell, which we call as hyposmia. An ability not to perceive smell well or altered smell perception would be called as parosmia. The brain doesn't have that ability to perceive the right sense of smell. Commonly used terms with olfactory dysfunction are PTOL, post-traumatic olfactory loss. And this is very important because sometimes along the olfactory pathway we can have fracture of the cribriform plate of ethmoid, in which we can interruption of the olfactory pathway with resultant CSF rhinorrhea. In addition to that, we can have PVOL, post-viral olfactory loss. Even small viral or minor viral infections can cause olfactory loss. Common cold, hay fever, allergies, nasal allergies can cause altered perception of smell. In addition to that, we have to remember that certain tumors, especially frontal lobe tumors and especially frontal lobe meningiomas at the base of the brain, can press upon the olfactory path and cause interruption of olfactory signals towards the brain, as a result of which we can have altered or decreased or absent smell perception. One clinical condition we have to be very much particular about is the Kalaman syndrome. And this Kalaman syndrome, especially in females, can cause hypogonadism, hypogonadotrophic hypogonadism with delayed puberty, and anosmia. Anosmia tends to be one of the important features of Kalaman's syndrome. I think these important points regarding the olfactory nerve and the olfactory pathway would be helpful to you. Thanks a lot.